Are we knee-deep in a mental health emergency? Has someone you know been impacted, or possibly even yourself? The numbers say yes, and they are sobering. The National Alliance on Mental Illness says 1 in 5 U.S. adults experiences mental illness each year. Looking just at Maryland, the group says nearly 200,000 adults in the state have a serious mental illness, and nearly 60,000 Marylanders ages 12 to 17 have depression. Hello and welcome, I'm John Aaron, and this is Views from the Frontlines, Maryland's mental health crisis. Joining me now, Dr. Marissa Leslie, Medical Director of Compass Health Center, Maryland, Dr. Holly Mears, who leads the emergency medicine and hospitalist teams at Holy Cross Health, Ann Redmond, school counselor at Thomas S. Wooten High School in Rockville, and Maryland State Senator Will Smith, a Democrat from Montgomery County. Thank you all for being here. Dr. Leslie, if you could take the floor first, just how bad is it right now?
Well, it is a crisis. That's not hyperbole. We have many children and adolescents, as well as adults, waiting in emergency departments, sometimes for hours and sometimes for months, quite honestly. Just wanting to access the right care at the right time, but finding difficulty accessing that care.
And Dr. Mears, you're the emergency department physician. Where do you fit in here?
I totally agree with Dr. Leslie. I mean, it is a shame that, whenever I see a patient, they're coming in absolute crisis where they have nowhere to turn. And I think that sometimes our healthcare system is difficult to navigate. And whenever they come in, it's difficult enough whenever you're at your optimal level. And then whenever you're having some mental health crisis, then trying to navigate it, it makes it even more complicated. So I think that's where they sometimes end up with me in the emergency department and many other emergency departments across our state.
Moving down the line, Ann, what's your experience at school? Hopefully you can catch these kids before they reach something serious like the ED.
The goal is to catch them early on, and one of the things I think is very impactful is that we are starting to look at mental health as something that we need to actually take steps to make sure that our students, and ourselves as well, are doing what we need to do in order to have good mental health. But that being said, it is a crisis. According to the CDC, Centers for Disease Control, 30% of our students, 30%, have poor mental health. And they come into school, and sometimes they're not even able to get to school. It is contributing to chronic absenteeism, is having an increase in students having fights with each other because they don't know how to resolve conflict. It's permeating the entire school system. And we're doing as much as we can to try to help. But the reality is, without having those supports in the community and having places that students can go to get good mental health, is very difficult.
And Senator Smith, will dive in a few different angles with you, but just what is your broad view of what constituents are dealing with right now?
Sure, with constituencies, but also as a policymaker, we're looking to make informed decisions moving forward. And so just last year, we have reports that 838,000 Marylanders had some sense of mental health or issue or crisis. We're a state of 6.2 million, so it's a significant percentage. Over 1 million Marylanders who need access to mental health services don't have it and live in areas where there's just not the services are not available. You heard 30% of our students come to school every day with some sort of a mental health issue. Only 2/3 of those students are getting seen and getting the health care that they actually need. And so there's a significant problem across the spectrum. I'm the chairman of the Judicial Proceedings Committee in the Maryland Senate. And so there's a direct nexus between mental health crises, and our criminal justice system. We can talk a little bit more about that later, but we've got a significant crisis here in Maryland as well.
Well, we could talk a little bit more about that and related issues now. When I ask you the question, how did we get here? How did we get to this crisis point?
Sure. Well, from the governmental side, we have underinvested in some of the structures and supports that we really need to handle the mental health population because it simply wasn't always a priority. Our jails have become de facto mental health treatment facilities in the state of Maryland. This is across the nation. If you look at, we have one Perkins Center, which is a center used for folks that have violent criminal tendencies, but also mental health issues or substance abuse issues. We only have one in the state of Maryland, and there's a long waiting list. You look at the juvenile justice system. We don't have a single facility to treat mental health or substance abuse for youths in our criminal justice system in Maryland. And so these are structures that we've got to build out and understand. As we all as a society understand mental health and substance abuse, our government systems need to evolve to handle those issues.
And that's not a small project by any means. Would anyone else like to jump in and answer the question, how exactly did it get to be a crisis? Dr. Leslie?
I would say it started with stigma. I think it started by segregating mental health and health. And one of my personal mantras is that mental health is health. And thankfully, the younger generations are more open to talking about their mental health issues and to seeking assistance. But because it's been so stigmatized, I think it's been underinvested in, as previously mentioned, and I think people are reluctant to seek care. So by the time many people seek care, it is a crisis, as opposed to being preventive and something that's maintained and nurtured, like our physical health.
Dr. Mears, I take it you've been practicing a while.
Yes.
Have you noticed things get worse, get to a crisis point, or has this always been an issue that's needed to be addressed and maybe hasn't been fully addressed?
Well, I think there probably has been, some issue with addressing things. I think Dr. Leslie's correct that there probably was a stigma associated with things that people didn't try to address mental health problems. But I think people also have probably self-medicated with drugs and alcohol. And because of that, there's a whole nother issue with, opioid crisis and many other substance abuse problems in our community. And I think that people may be self-medicating behavioral health issues or the concurrent mental health and substance abuse together. And that sort of makes it, even the more difficult to deal with.
I'm getting the very clear picture that this is something that is the result of many, many, many factors that all have come together to create this. And what have you been seeing in schools over your tenure? Do you think that things have gotten worse? I'm sure you see things like the self-medication and things like that.
Absolutely. But one of the things that we're finding is our students they're really struggling to make relationships with others. And that is partially because of social media, the cell phone, but greatly impacted by the pandemic. So back when I was young and I went to school, I would go, and every day at school would be dozens of little interactions with people where you would learn some social emotional skills along the way, how to deal with conflict, things of that nature. But our students today, if they go into a situation and they're not feeling comfortable, they can just pull out their cell phone. Like if they have a disagreement, they can pull out their cell phone, post it to social media, and they have tens of people coming back to them quickly and saying, "You're right, that person never should have done that. You're right, that person's wrong." And they're not navigating those relationships with others. And when you put that along with the pandemic, they were literally at home, in their homes, trying to stay safe from the virus, not turning on their not turning on their cameras or their microphones, and only interacting with people that they felt comfortable to do their interactions with. And as a result, all those little developmental milestones that we would have had, we just didn't have. And then they came back into the school setting, and it's almost as if they had plateaued. So they're coming into the high school setting with middle school skills,
Sure.
social and emotional skills, and that's causing some difficulty for them. So we really need to do all that we can to make sure that they're getting engaged with their peers, with the adults in their lives, continuing to destigmatize. I do agree. I think our young folks are way better at that than we are, because we've made a very specific effort in Montgomery County Public Schools to make sure that they know they go hand in hand. But we need to build those relationships up. Without that, you don't have that social support system that you need to try new experiences. And I think that's one of the main reasons why we're seeing so much depression and anxiety specifically in our youth.
Whether it be a patient, a student, a constituent, does anyone have a specific story that really drives home the seriousness of what we're going through right now?
Well, I had a student just last week that we had to do a crisis intervention, and it was like, okay, so we need to get you some support. And just like you're describing, they have to go and they have to sit in an ER room for hours waiting to find out, is there going to be a place for them or not? And that particular student was sent home to wait that there would be a place opening up hopefully next week. So here you have a student who's trusted you enough to come forward and say, I'm noticing these signs in myself and I think I need some help. And that's what you tell them, that they need to come back. That student might decide that they won't come forward the next time. And we certainly don't want that. And we don't want them telling their friends that. So absolutely, it's not having those support systems, not having those programs available to them makes a big impact.
If I could add,
Yeah.
and I'm actually excited to add this, on the flip side, our center where I lead, Compass Health Center, we have a similar story, except the young person did not have to go to the emergency room. This young child was in a situation where their emotions were very intense and they were engaging in unsafe behaviors at home. Instead of this young person going to the emergency department, they called our center. We got them in the next day, and this person has not had to go to the emergency department or inpatient. We worked with the parent because there were many family issues, which I also think is part of how we got here. We really helped deflect a lot of crisis, and it wasn't easy at first. And you know, this young person wasn't excited about being in our treatment facility, but over time got closer to other children and adolescents. We were able to offer family therapy. I was able to help manage medications along with my colleagues. And so I'm telling you the story, but I'm also really excited because our center has really been part of the solution.
Yeah, Dr. Mears, do you need more Anns and Dr. Leslies to keep people from getting to you?
No, that would be wonderful. I mean, I think it's because really the emergency department, we're there for emergencies, but there's so many other, it's really not the best venue. And, Dr. Leslie mentioned, and it has been the case where they're not only waiting for hours, but for days and months at times for really complicated cases with, special needs such as significant autism, trying to find the places where these people can sometimes get help. There's so few that they have to wait in the emergency department, and that is just not a positive place for people to stay. I mean, we try to get Child Life and other places, other people and resources involved to try to make it as optimal as possible, but it's just not the optimal place.
And Senator Smith, I know this probably hits home for you as a service member. We've heard that number of up to 17 veteran suicides a day.
Every day.
How does that strike you and lead you to believe that you need to be part of the solution here?
It's funny you were going to say that. So from our schools to our military, I think as mental health and mental health treatment and awareness has become destigmatized, the military has really leaned in on ensuring that service members get treatment, that there is no stigma for stepping up and saying, hey, I need help, that you're not going to lose your security clearance, for instance. We've changed those things, and all the way through to our public school system where it is destigmatized, and it's actually important for you to go and get your mental health checkup just like you go to get your annual physical. And in government, I think that's because we've been more open and honest about these conversations, because we now have more data to tell us what's actually happening on the ground. You've seen now organizations and government agencies that have been siloed coming together to help solve this problem and build the infrastructure and the supports necessary to make sure that everyone has access to mental health care. The Maryland Department of Health, the Judiciary, the Governor's Office of Crime Control and Prevention, GOCAP, have all now started working together with the legislature to proffer solutions, because now we're clear-eyed about what we're dealing with.
We'll be getting into more on this issue, possible solutions down the line, also ways to access the mental health system. You're watching Views from the Frontlines, Maryland's mental health crisis.